Good morning, Trinidad and Tobago. Good morning to you wherever you are. This is the Now Morning Show, and I'm Lisa alongside Carrie. Good morning, Carrie. How are you doing?
Good morning, Lisa. I'm doing terrific or tremendous on this tremendous Tuesday.
Good, very good.
Doing a lot better compared to how it was yesterday with the Saharan dust.
Yes.
Yeah, I'm feeling a little bit better this morning, at least. So
Yeah.
hopefully other people are faring better as well.
Yeah, because there's been no getting around it. The Saharan dust is everywhere, guys. And on the line we have with us this morning, we're going to be talking with Dr. Erica Wheeler, who is joining us via phone because yesterday the air quality of Trinidad and Tobago ranged between 148 to 151, hovering between unhealthy for sensitive groups to downright unhealthy, just unhealthy. And what does this mean for the persons with or without underlying health conditions? We have on the line, as I said before, Dr. Erica Wheeler, PAHO WHO country representative for Trinidad and Tobago and the Dutch Kingdom Islands. And Dr. Wheeler, I think we have to give Dr. Wheeler a medal, you know. She's been
Right.
working non-stop. Good morning, Dr. Wheeler.
Good morning, Lisa and Carrie.
Good morning.
And what can you tell us about the air quality and the impact on our health, especially with regard to the Saharan dust?
Well, as you yourself just said, it is particularly bad. It has been for the last few days. I don't know if it's something we should be proud of or not at this point in time that we do have, although Trinidad and Tobago has joined a global organization that can track the quality of our air. So whereas before we were not part of a global network, now we are. But at this current point in time, for those who are sufferers,
Yes.
especially those who have asthma, the advice is to stay indoors as much as possible. The other part of the advice we have is now at least people are wearing masks, but there are masks that can keep out as much dust as possible, some of the very, very small particles of dust.
Mm-hmm.
So persons can seek out such masks. They can check with their doctors or the pharmacy, because you can wear a mask that is specially designed to protect against dust and other very, very fine particulates. But also, one of the habits that I hope that we've been developing quite well for COVID-19, washing your hands regularly and not touching your eyes
Right.
is also something that we need to do, because we don't think about it. The particles are so small and we can't see them, but they do adhere to our skin. So the washing of the hands and avoiding the touching of the eyes and even protecting your eyes as much as possible is something that we recommend. Of course, adults who are severe sufferers have to take medication. That is unavoidable in some instances. Otherwise, it can cause serious sinus problems.
Yeah.
So that's it for, I think it's particularly difficult for young children, but at least at this time when there's no school, they can be kept indoors as much as possible.
Yes. So I went online this morning to check the air quality index, which is a moving target because it changes, it updates on the hour. And whereas yesterday it was hovering between 148 and 151, this morning it's now down to 85. I noticed the Northern Caribbean is now showing, the numbers that we were seeing and even higher, which means that it's moving northwards. Yes? What can you tell us about the the campaign, the Breathe Life, the Trinidad and Tobago Breathe Life campaign, and our involvement in this campaign?
Okay, so the Trinidad and Tobago Breathe Life campaign is part of a global campaign looking towards reducing emissions and also improving the air quality, because we recognize that air quality has an impact on human health. And the country's Environmental Management Authority, together with us at PAHO last year, we began working on a roadmap for air quality for Trinidad and Tobago. And I believe earlier this month, Trinidad and Tobago was the first country in the Caribbean to join the Breathe Life campaign. And the idea really is to mobilize both cities as well as individuals to protect their health and the planet from the effects of air pollution, because the discussions on climate change recognize that air pollution is also a significant part of the damage that's done to the health of human beings. So it is really kudos to Trinidad and Tobago and the Environmental Management Authority that they actually were able to get themselves in a position where they could gather the data from the existing what do you call them, ambient air quality monitoring stations, and upload that data so we can track the data in real time. So those persons who are sensitive and who are at risk, actually now, as long as you have a smartphone or computer, tablet, anything, can check where we are not, where we are globally, actually,
yes.
and compare ourselves globally.
Yes.
So that is actually a plus. And the plan is for Trinidad and Tobago to increase the number of stations from 3 this year to 5 by the end of the year. So we will have an even better coverage.
Yeah, so the importance of that is that you get real-time information with regard to what our air quality is, and particularly now that we are being impacted by the Saharan dust.
Yes, and there are measures that say when the air quality is good, moderate, and even unhealthy for sensitive groups. There is that category, and you can actually click on it. I think it will be great if somehow, I'm not sure, because
yes, we were working on it. We were working on getting that link up to show how you can click on it, but I don't think it's going to come up during the interview right now. Yeah, but
well,
you can go ahead and explain how it works.
Okay, so how it works is that every day these ambient air quality monitoring stations, they capture the amount, well, in this case we're talking about Sahara dust, so it captures the amount of what's called particulate matter in the atmosphere, and it gives a score. The scores, they are by ranges, going from good to moderate to unhealthy for sensitive groups, downright unhealthy and very unhealthy. So
okay, and Dr. Wheeler, right now we have on the screen the map, the global map, and we've just zoomed into Trinidad and Tobago, and we are seeing where Point Lisas is reading at 57, which says moderate. Yes. But I think Tobago, if you zoom into Tobago, it's at I was seeing 85. I'm seeing near to Aruba is at 132. So that's Curacao actually. Shows at 132, and we were just showing the movement on the map real time, which shows you how islands north and countries north of Trinidad and Tobago, there's somebody, I think Martinique is at 192, Dr. Wheeler, which is unhealthy, even purple, so you're actually seeing the color codes, and somebody up north there is at 175, I believe it is Guadeloupe. So the Saharan dust obviously moving northwards, but Trinidad, if we go back to Trinidad and Tobago, we will see where our numbers have come down overnight.
Yeah, exactly, that's precisely so, because they were very high overnight. And the orange that you see there is unhealthy for sensitive groups. It means members of sensitive groups may experience health effects, but it says the general public is not likely to be affected. But at least with this, there can be some preparation. And parents, for example, who have children that suffer from asthma, it was good if they are aware of this and they actually check it regularly, so they know how to treat with their children. Because yes, we can, thankfully now, we use masks without looking very strange.
Yes.
So parents need to take care, keep their children in. It's unfortunate that at a time when they're home and they should be running about, that they can't always go outside. But if you check the ambient air quality, you would know when it's safer for children to be outdoors, and for adults, whether they should actually be thinking of taking their medication.
Yes. So, Dr. Wheeler, this is such an opportune time to provide information with regard to this site. Is there an app that you can download on your phone, or is there a link? How do you get access to it?
Yes. So the link on the World it's called World Air Pollution, the Real-Time Air Quality Index. If you put it into Google, Real-Time Air Quality Index, it's called WAQI.info.
Yes.
If you put that in, you should be able to get this map.
Okay,
And
so it's
will then help you to track the air quality.
all right. So it's WAQI.info, or just
Yes.
Google the real-time air quality
Yes,
index.
the index, yes, and it is global, as you can see from
Yes.
the map. It's global, which
Yeah.
is quite exciting for us to be on it. And we are the first in the whole of the Caribbean that has joined this, so that we can see for ourselves.
Right,
Yes.
yes. Well, Dr. Wheeler, thank you so much for joining us and bringing us up to date with what's happening with the Saharan dust, and to provide us with this new information, with Trinidad and Tobago being part of the TT Breathe Good Quality Air Campaign. Dr. Wheeler, of course, is the PAHO and WHO country representative for Trinidad and Tobago and the Dutch Kingdom Islands. We're going to be taking a few messages and come right back here on the Now Morning Show after this.